The South Sudan HIV and AIDS Commission, in collaboration with the United Nations Development Programme, has intensified its effort to enhance access to justice and combat the persistent stigma and discrimination faced by individuals living with HIV and AIDS. A three-day training of trainers aimed to strengthen participants' understanding of legal and human rights issues related to HIV and AIDS. We have the report.
In a renewed push to address the growing challenge of HIV and AIDS-related stigma and discrimination across the country, the South Sudan HIV and AIDS Commission, in partnership with UNDP, has launched a major initiative aimed at expanding legal support services for the people living with the virus. The program brings together legal practitioners, healthcare workers, government officials, and representatives from civil society and non-governmental organizations. Its goal is to tackle the legal and human rights challenges associated with HIV and AIDS. In his opening remarks, Dr. Justin Kawaj Makwe, South Sudan HIV and AIDS Commission chairperson, called on all stakeholders, government institutions, development partners, and communities to unite in raising public awareness and fighting stigma. He emphasized that ending discrimination is essential to controlling and eventually eradicating the pandemic.
Let's come short of asking from authority, nothing short of criminalizing stigma against people living with HIV/AIDS. Let's make HIV/AIDS a topic of discussion again. Let's catch up with the rest of the world. There are things that are unheard of in those sides of the world where I've lived that are still with us here in South Sudan. Things like vertical transmission, things like stigma, the issue of HIV being a taboo, not being acceptable to be discussed in front of people. The HIV/AIDS Commission in the States are the engine. If we are going to fight stigma, if we are going to fight for the justice of people living with HIV/AIDS.
Dr. Mariel Chuerkoch, Director General for Program Coordination at the Commission, described the training as critical step toward empowering legal professionals to provide meaningful and accessible legal services for those living with HIV and AIDS.
This time, as the Commission have started to train you, you are now trained as trainers. So you will pick the event. When you go back to your state, and you will be the one training your colleague at the front level. Your interventions in respective states are implemented.
Representing the participants, Moreno Michael Sabit, chairpersons of the Central Equatorial State HIV and AIDS Commission, highlighted the importance of programs and the need for sustained advocacy.
These events of today, organized by National AIDS Commission, is very, very important. So they brought all these 10 state chairpersons. The first agenda, so that we can know each other, 10 chairpersons in the 10 states. And then the main important thing is access to justice. Access to justice. الزول المصاب ده برضه لازم يلقى عدالة، يلقى عدالة صحيحة، عدالة قانونية. لأنه بنلقى لأن الزول زي برضه في ناس يدو discrimination، يدو stigma، يقول أنت مصاب، يدو كراهية، فعشان كده هو عنده حق زي إنسان، فعشان كده أو واجب الأولاني مننا نديه شنو؟ نديه احترام الكامل. واليوم ده بتاعت الليلة ده هو يوم مهم جدا. For those who are outside also, we also encourage them that also they have to also separate the message outside. At the end of the day, we need at least to reduce the rate of HIV.